Okay, so congestive heart failure, it's a bit of a group of conditions rather than an individual disease process, but basically what it refers to is what happens when the heart's not functioning effectively. So that may be because of endocardiosis, which I talked about earlier with leaky valves, hypertrophic or dilated cardiomyopathy, or any number of other conditions. But basically the presenting signs come about because the heart's not functioning properly, not pumping blood forward as it should do. And the way I tend to divide it is into left-sided or right-sided heart failure. And so if we basically look at the circulatory system, if we start off in the left atrium, the blood goes from the left atrium to the left ventricle. So the atrium is really just there to help fill the ventricles. From the left ventricle, which is the strongest chamber in the heart, it pumps out to the body. From the body, goes into the veins, back to the right atrium, into the right ventricle, and out to the lungs. And that process continues. So what can happen when we get some degree of heart failure? So if, say, we have left-sided heart failure, what happens is the blood is basically not getting pumped out to the body effectively. We get a bit of a backlog of blood, so it starts to put pressure back on the system here, and we end up with increased pressure in the blood vessels in the lungs, and those blood vessels are slightly leaky, and so we get an accumulation of fluid in the lungs, and that causes a cough. So the most common sign of left-sided congestive heart failure is a cough. With right-sided heart failure, what we get is it's a similar sort of condition where basically instead of all the blood going out to the lungs that should do, it starts to bank up a little bit, banks up into the body, and we end up having an increase in the amount of fluid in the general body. Now, the main place we see this in pets is actually in the abdomen, and that's particularly from organs like the liver. As the pressure builds up in the blood vessels there, once again they're leaky, leaks fluid, and we end up with quite an enlarged belly. And what we can find with that belly is if we pop our hands on each side of the pet and give it a gentle tap, we can actually feel the fluid wave coming through to the other side. So it's almost, if you imagine getting a water balloon and tapping one side of it, you can actually feel the pressure come right through to the other side of the balloon. The same thing happens with the body in right-sided heart failure. So that's the most common way we divide these up. In some cases, if the whole heart is causing problems, we can actually get a combination of left and right-sided heart failure. The way we treat it, we look at trying to manage the underlying condition, so whether that's a leaky valve or whether it's the hypertrophic or dilated cardiomyopathy, we treat those as much as we can. We may also give a diuretic, which is going to take the fluid basically out of the circulatory system, so there's less fluid in the whole system, so there's less pressure for things to leak. We may use drugs which will dilate the arteries, which makes it easier for the heart to pump. There's a few things we can actually do. So that's the basics of congestive heart failure. Like I say, it's not a specific disease, it's more a group of diseases which cause certain presentations, but that's the basics of it.